Human trafficking and tuberculosis. Providing informed care.
This training goes over the basics of human trafficking awareness for those working in TB. It is brought to you by Louisiana's Tuberculosis Patient Advocacy Program. While trauma-informed care was utilized when creating this training, including not describing details of human trafficking abuses, there still may be triggers for anyone who may have experienced human trafficking. Why should TB healthcare professionals be informed about human trafficking? 1. Patients with TB disease are sometimes also victims of human trafficking. 2. Human trafficking dynamics can undermine healthcare solutions. 3. Victims of human trafficking may have extreme barriers to disclosing physical and mental health issues as well as seeking appropriate care. 4. The prevention of infectious diseases like tuberculosis becomes much more difficult when human trafficking is a factor. 5. Healthcare professionals need to know how to help versus harm victims of human trafficking.
Important to note. It is not the responsibility of our TB healthcare workers to try to save someone from being trafficked. Our responsibility lies in becoming aware of human trafficking to better care for our patients that may be facing these challenges.
Human trafficking, also referred to as trafficking in persons. The illegal recruitment, transporting, harboring, or obtaining of individuals by force or deception for the purpose of labor, sexual exploitation, peonage, debt bondage, or slavery.
As you learn, keep in mind the image of invisible chains or forces. Sometimes it is hard to understand why people in human trafficking situations don't just leave. It's important for us all to understand that there are forces beyond what we can be told or what we can see that influence a person's decisions in this matter.
Human trafficking victims can be anyone. This includes men, children, women, all genders, all races and nationalities. It doesn't require crossing an international border to be considered trafficking. And no one can ever consent to being trafficked.
Vulnerable populations include refugees and asylees, LGBTQI individuals, survivors of other crimes, individuals with physical and cognitive disabilities, immigrants and migrant workers, runaway youth, and people experiencing homelessness.
There are certain patterns to look for when determining whether or not your patient may be a victim of trafficking. In terms of health, look for symptoms of trauma, physical and psychological, illnesses or injuries associated with poor living and working conditions, missing or being late for appointments, fearful, mistrusting. You can put these together with the context of which they exist. For example, do they live or work in a sector commonly associated with exploitation? Are they consistently accompanied by a minder? A minder can be someone to look over another, and even someone that speaks for them, or makes sure they only say certain things. Your patient may have migrated locally or internationally. Do they know the language or even the dialect? Does your patient know where they are? Can they explain where they live?
Sexual exploitation and labor trafficking can be found in areas we never think about. Coffee shops, restaurants, high-end hotels, and even private homes.
Not all human trafficking results from kidnapping. Many times a deal is made for a loan, job, or transport to another country, and once the person arrives things change. Now the $2,000 they were going to work off turns into $10,000. The job cleaning houses turns into sexual services in homes. The job they were promised dancing ends up prostituting in strip clubs. Working as a field hand ends up being labor with no pay. They are often threatened with harm to their family back home, physical abuse, deportation, jail, and death. So who are the traffickers? Organized crime groups, small criminal rings, family members, romantic partners, opportunistic individuals, including pimps, gangs, and anyone willing to exploit the vulnerabilities of others for profit.
Check out this map. It shows, using heat gauges, the amount of calls received suspecting human trafficking. These are just the calls suspecting it, which actually shows some awareness. You can see the higher burden areas. There are also areas not highlighted that are controlled by mobs or lack awareness of human trafficking.
The health consequences for people being trafficked are severe. Here are some of the ailments that victims of human trafficking may sustain: substance abuse, sexual abuse, STDs, PTSD, isolation, infectious disease, overdose, head trauma, inability to seek help, unsafe abortions, genital injury, fractures, guilt, starvation, withholding medications, and so much more. How do we help and not harm? Briefly, we will go over the following 5 steps needed. 1. Understand unconscious bias and meet your own biases. 2. Know the negative impact of not recognizing human trafficking victims. 3. Become observant. 4. Think outside the box for ways to provide quality care while working around the patient's barriers. 5. When you spend time with each patient, remember that it is impossible for each of you to fully understand the other's story, and always be patient with yourself and others. Ada and her child come to the health unit for her child's vaccinations. Hello, can I help you? Are you here for WIC?
My child need immunize for school now. Cannot return until have it. Please get the appointment now.
Let's see real quick how unconscious bias can look. What did the healthcare worker possibly witness in this transaction? Well, she heard broken English. She saw that the child had ill-fitting clothes on. The mom spoke in a harsh tone, being very specific in her requests. And when requested, the mom had no ID or documentation for the child. What did the healthcare worker assume? She assumed that the mom and child had very little formal education, since the mom spoke English poorly. She assumed they were illegal in the U.S. because the child did not have documentation. She assumed the mom was taking advantage of a system she had never paid into. And assumed the mom felt entitled since she spoke in a tone that the nurse considered to be rude.
Unconscious biases sometimes blur our vision. This can be especially harmful for our patients. The truth is that Ada and her son have been through a lot. It all started about 3 months ago when Ada was working in her home country of Honduras as a physician. One day a woman dressed very professionally came to her and offered Ada a position in the USA as a doctor. She was offered to bring her son and promised a place to live with a salary of $75,000. Since things had gotten dangerous in her city, she thought about it a lot but then agreed to take the job. She packed up all her things, bid farewell to her family, and got on a plane to the USA. When she arrived in New Orleans, she was greeted by the same lady that had spoken with her before. They all got in a car together and headed out. While in the car, the lady told Ada that she had to give her passport to the lady. She explained it was just a safety measure. When Ada and her son got to a big house outside of town, they were escorted to their room and told that in a few days they would get their own place and start working. A few days later, a man came in and told her that the lady that had promised her everything was gone. There was no actual job. And her passport was nowhere to be found. When Ada tried to call back home, she realized someone had stolen her phone. When Ada said that she was going to the police, the man showed her a photo of a woman pointing a gun at her brother's head in Honduras. He told her that if they did not do as they said, then her family would be killed. And if she tried to reach out to them or the police, her little boy would be killed. When the man found her trying to call someone with a different phone, her son was taken from her. She finally got him back after 3 months of following their rules. She was told that he must go to school, so no attention was brought to him. He had been taught during those 3 months to not talk about his circumstances with anyone and had a story to tell if someone asked. Ada was dropped off at the health unit and told to get his immunizations completed. And if she told anyone, then her family back home would be killed. Can you imagine how important it is that she and her son maintain the rules? Ada may not be able to explain. She may want to just get the shots done and get back to her traffickers. There she knows that she can follow the rules and keep her son safe. If we don't realize that she may be going through this, then we may cause more pain. If we try to force a rescue of she and her son, we could end up getting more people hurt. Our job is to listen, observe, and care.
Be cognizant of the fact that touching a patient may be re-traumatizing them. Make sure to ask and observe to see if the patient is doing okay. If the patient prefers not to be touched, think of ways to work around their needs. If the patient is never alone and seems to be afraid to speak, see if you can get the patient alone by making up a reason that the observer would not take as a threat. Let the patient know that you can provide them with information on where to get help if you suspect trafficking. If they do not want to address it, then don't. If a patient is angry because he is waiting longer than he had expected, find out his reasons. He may need to meet a timeline that we cannot understand and he cannot explain. The patient may also use anger as a defense against anyone asking personal questions. Do your best to just listen and provide care. Some patients may want help but are unsure how they can get it. You can give them a flyer inside another paper that they can secretly read later. But always be careful. Make sure they want it. If found later by the traffickers, the patient could get in trouble.
In 10 minutes, we cannot go over all of the ways we can help and not harm victims of human trafficking. For more information on human trafficking, go to https://healtrafficking.org/ Thank you for your time and your service to those most vulnerable under your care. Just by watching this short video, you are on your way to making a positive change in this world. Thank you.